My role in the primary care centre is to see patients that present in the surgery appointment-based with a range of minor illness conditions from headaches, viral infections, chest infections, abdominal pain, diarrhea and vomiting, fainting episodes, quite a wide scope of minor illness presentations that they may have an appointment for. I also do home visits at the end of the morning or at the end of the afternoon, and also sometimes we'll do a home visit if there's an urgent case that needs to be seen. Most patients that present with minor illnesses don't necessarily need to see a doctor. I've got the correct level of training and education to be able to take the history, give them a thorough examination, make a correct diagnosis, and treat and prescribe to them the medication they require and give them the advice they need. And it's nice when you get feedback off those patients to see they're doing well, and that's the aim of the role really, is to get patients fitter and more healthy, and then you get quite a lot of satisfaction from that.